Alright. Knock knock. Wash my hands. Put cues in, bed is in the lowest position. The name is, or the name and whiteboard are updated with correct physician and staff. Today's date. No clutter in any walkways. Patient is not on, sorry, the patient is on oxygen. There is no trach, there is no drains, no stomach tubes, no Foley. Bed is in the lowest position, 3 side rails up. The name band is correct, verified by the husband, Miss Black, 31 years old. Water pitcher is nearby, although she's not responsive right now. And yeah. So, Mr. Black, can you tell me what has brought your wife into the emergency room today? What did the squad bring her in for? Oh, there's a saline lock on her left anacube, which was from the EMTs. So you're saying that she's been quite anxious ever since she's given birth. When was that? Okay, 2 weeks ago. Okay, does she have any other history, like health history? You say that she's been having diarrhea and vomiting as well for the past 2 days. She hasn't even been able to feed the baby because of how anxious she's been. Okay, so let's take a look at her past history. Did she have any complications with the pregnancy or delivery? Okay. Vomiting, diarrhea, which you said yes. Any bleeding, any excessive bleeding that you know of? And then it looks like here she has a history of hyperlipidemia, Graves' disease, and asthma. She's taking some medication for that daily. Okay, and plus her rescue inhaler. Okay, good. Alright, well let's go ahead and I'm going to get vital signs, do the assessment, and we'll see what's going on, okay? Just going to wash my hands again. Vital signs, temperature, pulse ox, respiratory rate, blood pressure, and heart rate. Okay, so heart rate is 145, blood pressure is 120/76, respiratory rate is 32 beats a minute, breaths per minute, and temperature is 101. Her O2's at 89% on 4 liters, which was already noted. Okay, so let's go ahead, take a listen, wash my hands again. Miss Black, Miss Black, Miss Black. Okay, so she's being unresponsive. She's just repeating her husband's name. I'm going to go ahead and put the bed down just a little bit. There we go. And you look in my pen, Miss Black. Okay, she's unresponsive right now, so I can't do a correct neuro assessment with her eyes. But I do note some redness and swelling around them. Take a listen. Listen to that apical pulse for a minute. Very rapid and irregular heart rhythm. All right, let's listen to the lungs. We're noting some crackles bilaterally. In the back. I hear crackles back here as well, bilaterally. Chest seems to rise and fall evenly, though. Okay, I'm gonna turn your head this way. There's no JVD present on this side. No JVD present on the other side. So I'm gonna let your bed down a little bit. There we go. Then take a peek at her belly. It's soft, flat, non-distended. Her skin is pale, a little bit clammy. Oops, I didn't mean to touch that, sorry. We're gonna listen. I was touching your skin. Didn't mean to palpate. Alright, we're gonna listen to your belly. Mr. Black, do you know when the last time she had a bowel movement was? Okay, and has she noted any kind of discomfort whenever she's urinating? Or any increase in frequency? Okay. No? Okay. No guarding. Alright, Miss Black, I need you to hold my hands. Okay, non-responsive to that. Unable to follow commands. I'm going to check her cap refill. Less than 3 seconds. Good. Radial pulses are equal bilaterally. I'm going to check the lower extremities. Good. Cap refill, less than 3 seconds. Pedal pulse is present. Equal bilaterally. Good. Alright. No skin breakdown anywhere. No lesions. Okay. I'm going to go ahead and report my findings to the healthcare provider, and we'll kind of go from there. I think that he'll probably order some lab work, full metabolic panel, just blood work. Okay, sorry, that cut off. So I'm going to go report my findings to the healthcare provider, and then I think that he'll probably order some labs, full metabolic panel, thyroid panel, CBC count to see what's going on, to see if there's any infection. We're going to get some ABGs drawn to check out metabolic state and see if there's any kind of funkiness going on there, okay? So I'll come back, wash my hands. Alright, knock knock. Sarah again, wash my hands. Alright, so I'm going to come in here and check. You say that your wife is a little bit more out of it and a little bit more, a little bit worsening of the unresponsiveness. Okay, let's go ahead and check your heart rate. Okay, it's 155, so that is really high. It looks here, the provider did order EKG, a 12-lead EKG, and it looks like they are going to intubate to protect her airway, okay? So respiratory will come up and decide if they're ready to do it now or if they can, if they need to wait for any reason, okay? So I'll come back in. Wash my hands. Alright. Knock knock, Sarah again, wash my hands. Okay, so from what I've understood, respiratory was not able to, the respiratory therapist was not able to intubate because they did feel a swollen thyroid gland. So the anesthesia team came in and did do a successful intubation. Let's go ahead, check our EKG results. Okay, so it looks like your wife is an AFib with a very high heart rate. It's called rapid ventricular response. It may be a reason why, an underlying reason of what's going on, like an electrolyte imbalance, hormonal imbalance, which can cause a severe tachycardia. Okay, so the lab results are back. Sodium 144, potassium 5.0, magnesium 1, bun and creatinine 11 and 0.7. We got some stuff going on. Thyroid stimulating hormone 0.1, which is extremely low. So we're going to go ahead and admit Miss Black, your wife, to the ICU, transfer her over, and we will go ahead and get everything taken care of. Okay? It looks like we call this a thyroid storm, and sometimes it's caused typically by like an initial hormone imbalance, and stress can really exacerbate the issue. Which can lead to severe tachycardia, arrhythmias, nausea, vomiting, diarrhea, and her low TSH level gives us a good idea that her thyroid hormone level is likely pretty high. So I anticipate the provider ordering a beta blocker or a calcium channel blocker for her hypertension and tachycardia. So that's going to lower that heart rate down. And then something to bring her thyroid stimulating hormone up, which will then bring her thyroid hormone level down to get her out of that crisis situation that we're in right now, okay? All right. And then so I'm going to go ahead and give her Itenerol. It's 1 milligram IV push 3 times a day. And then I'm going to go ahead and hang a bag of normal saline that's going to be running at 100 milliliters an hour. Okay? Any questions, Mr. Black? Okay. I'm going to gather my supplies. Okay. Wash my hands, put gloves on. We are going to run your normal saline first. So first we are going to be sure that this line is primed. So we would spike the bag. Make sure there's no air in the line. Let it run free. There we go. Okay. So we're going to come over. We're going to pretend this is a nice big size normal saline bag. And since this port is saline, or since her IV site is saline locked, we're going to take an alcohol swab, clean off that hub. This is sterile. So, oops, this is still sterile. So we're going to attach it. Good. And we're going to attach it there. We're going to set the IV pump to 100 milliliters an hour. Wash my hands, and then we're going to prepare medication. Miss Black, do you have, or you're unresponsive. Mr. Black, does she have any allergies to any medications? No? Okay, good. Alright, so we're going to check the order versus what we have, Correct patient identifier, Miss Black, she's 32 years old. What we have is Endenerol. Okay, Endenerol. So Endenerol. This is a 1 milligram IV push. So this is 1 milligram per milliliter. So we're going to draw 1 milliliter. So first we're going to pop the cap, take an alcohol swab, clean off the top. And this is our sterile syringe. We're going to withdraw a milliliter of air, inject the milliliter of air into the vial, then withdraw our solution. Okay, and then we have a little hub on our IV, normal saline that's running. So we're going to take an alcohol swab, clean off that hub. We're going to inject this IV push over 1 minute. Oh shoot, we're gonna first, I didn't start do that yet. We're gonna or no, never mind. Yeah. So here, since there's already something running, we don't have to flush it. So we're gonna push it over 1 minute, noting any redness or swelling at the IV site. Okay, so 1 minute's elapsed. Miss Black tolerated that pretty well. Alright, so Michelle's going to come in and she's going to take over for me, Mr. Black. So I'm going to go ahead and report off to her real quick. Alright, Michelle, this is Miss Black. She is intubated right now. Yes, still intubated. Sorry, I had to be sure. Still intubated, but she is now stable. Mr. Black is her husband. He's been at her side the entire time. Came into the emergency room via squad a couple days ago. She was a little confused at home, very anxious, postpartum, 2 weeks. History of Graves' disease, hyperlipidemia, asthma, controlled by medication. Very anxious. It turned out to be a thyroid storm. TSH was 0.1. EKG, 12-lead EKG was noted. AFib with rapid rate at 155. So we have her on Idenarol, 1 milligram IV push 3 times a day, and we're gonna hold that if the blood pressure is less than 100/60. She does have half normal saline running at 100 milliliters an hour also. Since she is intubated, she is a turn every 2 hours, and hopefully in a couple of days her condition will still be on the uprise as expected. Do you have any further questions, Michelle? Okay, good. All right, Mr. Black, take care. Hope to see you getting a little bit better tomorrow, okay? All right, wash my hands.